My question is to the Minister of Health. Speaker, by now, this Liberal government is quite familiar with the case of Stuart Cline, a London man who passed away on Saturday. Yesterday, Stuart's son David went on the radio and asked for an apology from the Minister of Health. David had listened to her response to my question last week and was offended to hear her say that her ministry was fully engaged in helping to coordinate this individual's return home. In fact, David says that the minister did not make one phone call to our family the entire time, neither her nor anyone who worked for her. I took that as an insult. Speaker, will the Minister of Health apologize to the Cline family for this insult?
Thank you. Minister of Health,
Well, thank you, Mr. Speaker. And of course, the death of a loved one is an extremely difficult and painful experiences, and I do send my deepest condolences to the Cline family for their tragic loss. I know that the Premier also expressed her condolences yesterday. Ontario's healthcare system does stand ready to support any patient returning home with an illness or injury experienced while travelling. We know that there are beds available for critical care patients in Ontario, and so we would continue to urge travel insurance to work with our LHIN staff, with ministry staff on the ground to offer protection and coordination of medical services for their clients. I know that this is a really horrible tragedy for the family, and something quite unimaginable happened while their father was out of the country. So I want to again express my deepest condolences. Thank you, Mr.
Speaker, David Cline said on the radio that it was inexcusable for the minister to try to avoid accountability for her government's role in this heartbreaking situation, which is what we just heard again. David Cline stated, what compounded the problem is that the health minister, by not taking responsibility for the problem, made it much worse. She blamed the insurance company, but the insurance company made multiple phone calls in different cities. Speaker, yesterday in this House, the Premier again pointed the finger at everyone but herself. Why is this Liberal government blaming others instead of taking responsibility for their own failings?
Good question. Thank you. Minister.
Mr. Speaker, we need to say again that when you go out of the country and you purchase travel insurance, you are relying on that travel insurer to work with our healthcare system. We rely on travel insurers to do their due diligence, to engage our network of hospitals here at home. Beds were available. Healthcare professionals were on the ground. There was LHIN staff responsible for regional care coordination, and our staff at the ministry are willing to go the extra mile to ensure the highest quality of care for Ontarians. And so I certainly am very committed to ensuring that that coordination communication mechanism is strengthened, and we will probably have more to say on that topic in the future.
Thank you. Final supplementary.
Speaker, for decades, Ontario's hospitals have been operating with year-over-year cuts. This has led to hallway medicine and a chronic overcrowding crisis that is hurting families like the Clines. Both Conservative and Liberal governments have made it a habit to cut and freeze hospital budgets. Frontline healthcare professionals deserve the resources necessary to treat their patients. And when an emergency happens, whether a person is in Ontario or out of the country, they should be secure in the knowledge that our healthcare system will be there for them. David Cline and his family are no longer secure in that knowledge. How does this Liberal government plan to change that?
Mr. Speaker, I'm going to have to reiterate that there were beds available. At the level 2 and 3 type bed in ICU, on February 26, Toronto had 31 beds, the Southwest LHIN had 16 beds, the Erie St. Clair LHIN had 7 beds, Hamilton had 34. We need to coordinate information between travel insurers and the ministry and we will be working on ensuring that that communication is occurring as well as is possible. Thank you, Mr. Speaker.